Okay, so good morning, everyone. It is in this period of lockdown, it is so amazing to see so many people online. At least some bit of interaction keeps us all alive. So my name is Karan Thakkar, and we run a recycling company called the Recycling Company. And in this entire phase of lockdown, we have been, just trying a bit to do webinars and chats and live show on largely recycling, sustainability, and environment related topics, because that is what our core is. That is what we are very passionate about. But one constant thing that we have on our minds is, of course, the coronavirus, because that is why we are in a lockdown situation. uh, what are the tests like? Are tests easily available? How does one person get infected? If one has to be admitted in a hospital, are there enough services available? What is the cost? Is it going to be too expensive? So many questions. So I have a 15 months old daughter, and every time I go down to even buy groceries, my heart is always pumping, that just hopefully I don't get infected and it doesn't come back to my house. So there are always so many questions, and during this phase is where we came across a story of Harsh Vajani. On Facebook, I just saw that he was posting pictures from hospital and his entire journey of how he got the virus and how he came out of it. And there were just so many positive messages around, and we thought, I think it would be such an amazing thing to get him to chat with us and ask some basic questions that we have in our mind, like I just mentioned. How does one get tested, so on and so forth. And we are so happy and so fortunate that Harsh agreed to do this chat with us, and I'm sure so many people have such basic questions like we do. So today we have with us Harsh Vajani. Hi Harsh.
Hello, everyone.
Great. So again, Harsh, thank you so much, and it is just lovely to have somebody who can actually talk to us about the virus and some basic things, because I think there is such a large population which is locked down indoors, and few people who have experienced it outside, and I think which is where there is so much of fear in our minds, and because we don't know. So let us start today's conversation with our very own coronavirus fighter, I would say, not survivor, because I think it's a lot about mind over matter and how positively you have come out of it. My first question is, how and when did you get infected?
So it happened this way that on 20th of March, our Honorable Chief Minister of Maharashtra announced that, Maharashtra would be shut down from 21st of March till 31st of March. So I had got some urgent work in my office. By the way, I'm a chartered accountant by profession. I'm currently working with BDO. So my office is in Villeparle. So I had to go to my office for some 3 to 4 hours. I took a cab and I went to my office. I did some work, urgent work, which I was supposed to finish off. And I was returning back home. I also took some groceries uh,
On your
on
way
the
back.
way.
Mhm.
So I suppose I would have contracted maybe the cab which I took, or maybe the grocery place where I had been. I met some people. So that is how I feel. I'm not sure as to how I contracted, but that was a very unfortunate thing. Uh, how I contracted the virus.
So this is on 20th, and I mean,
Yeah,
what did you feel that it was on 20th? So 20th, you were taking a cab back home, you bought some groceries, etc. And then what
yeah.
happened? Were you not well for a few days?
So on 20th, I was okay. Nothing as such on 20th. But then immediately, next day and thereafter, my symptoms started developing. So my symptoms were, I felt a bit cold. I developed chills. I had a very bad body pain. I had a stomach pain.
Okay.
And then I approached my family doctor. So my family doctor prescribed me normal flu fever related medicines, which I started taking. So that is how it initially started.
So again, this is a very recent thing that happened, and I think by then there was just so much of information and panic about the coronavirus already spreading. So wasn't the first reaction of your doctor that let's get a COVID test done because of the current scenario?
So I'm talking of those days, around 20th,
Correct.
22nd, those days. So those days, our testing kits were very limited, and maybe every day or two, in an interval of 2 to 3 days. What I know from my doctor is all the doctors were having those different guidelines with respect to COVID and all.
Okay.
So immediately doctors were not supposed to test कि चलो भाई फीवर है तो जाओ immediately जाके तुम तुम्हारा कोविड का टेस्ट करा लो, because we have a scarcity of the testing kits in our country. So my doctor prescribed me a normal medicine, but then after 2 3 days I was not having that improvement. My
Okay.
situation was worsening, wherein I had lot of weakness. I was almost sleeping
Mhm.
the whole day as such, and medications. He said then his diagnosis came as if I would be having either dengue, malaria, and he also had some possibility that I could also have this COVID infection going on since it's an epidemic. So then
Correct.
he suggested that I'm changing your medication. It's better that you sleep in a separate room and let your family sleep in separate room. Try to maintain some hygiene as to you are keeping your clothes separate. You keep your utensils separate and all that. I was
And
doing it,
how many people
and
in your family?
still. So in
How
my family, I have my 3-year-old son. I have my mom who is 65-year-old, and
okay.
my wife who is almost my age, 36.
Okay. So
So I was taking those revised dose of medicines, but still I didn't have any improvement.
okay.
Then doctor suggested, let me do your test, couple of tests. So wherein I was told to do CBC, liver function test, and CRP. These are the tests that he recommended.
Okay.
And then the test result came out. My CRP was very alarming. That was so. Then he thought that better now you do your COVID test.
Okay.
So exactly on 27th, I did my COVID test.
So
So
20th you came back
luckily,
home. So 20th you came back home. For a few days you were not well. You did some few tests, and because you were not recovering, that then finally the doctor suggested 27th you do a COVID test. Correct?
correct, yeah.
So where did you do the COVID test? Was it the same doctor, or did he advise someplace else?
So those times, what I understand is, only Kasturba was a place where you were supposed to get yourself tested, and private labs were just introduced. So like Metropolis, Suburban, SRL, then this is Thyrocare. So all those private labs had just initiated. So I was just praying to my God that I don't have to go to Kasturba, because I had this in my mind that if I happen to go there for my testing, then I might contract. So
This is most of the
so
people.
then my wife so then my wife was actually speaking to all those private labs, Metropolis, Suburban. So
Like,
whosoever can come first
hmm,
and get my COVID test done on 27th as soon as possible. So then, luckily, we had SRL person who said he will come to my home in 2 hours.
okay,
There was a morning time when we had called morning time. Uh, we had called him, so he came somewhere around afternoon, around 2 o'clock. So
okay,
he came, he took my sample. So the sample for the COVID test, there are two swabs people take. One is deep inside your throat, another is into your nostrils. So
okay.
this is how that person collected my
And no
sample.
blood test. So there is no blood test in
No,
this.
no, there is no blood test. There is no blood test.
Okay. So, if I may ask, Harsh, is how expensive is the COVID test? And I think because so I think great that SRL diagnostic lab send the person, and everybody whom you
Mhm.
call, they have the test available. The is what you're saying, correct? And in 2 hours,
Mhm, mhm.
that was the first one to reach you, which is why you went to them. And how much did it cost you? How
Yeah.
much did you have to pay for the test?
So that test costed me 4,500. So that was a prescribed rate by the government.
Okay. Okay, great. So, and then how many days did you get the result?
So I was told that I would be getting my results within 48 hours.
Okay.
But I did my test on 27th.
Okay.
I got my results on 30th morning.
Okay. So it took 3 days.
Yeah.
Okay. And how was the first reaction? How is the test like? What was the first reaction when you saw the report and when it said it's positive?
So initially, what happened is I was very anxious. I wanted to know my test results. I was hoping that it should be negative because even I was under assumption that I am not suffering from COVID. I
Okay.
might be having a dengue or a malaria. That is what my family was also supposing. So then I called up SRL people. The SRL people, they informed that my test result is out. They have just mailed me, and they informed that unfortunately my test result is positive. And once I got to know that it's positive, it was a complete shock for me because I was then more concerned about my family, that
Correct.
my family should not be contracted with this virus.
Okay. So 30th is when the test result came in the morning. The result came positive. Of course, you were anxious. Then what happened? Like, okay, but I think one question that even I have, and I think a lot of people have, is that the minute you are tested positive, the BMC and the local authorities, they would just call you, or they would just take you and put you in a hospital. Like, there are just so many scary stories about how families are picked
Hmm.
up. Where they go, you never know. Where are they admitted, you don't come to know. You're not allowed to communicate with anyone, and then it's a complete cut off. The building is sealed, the flat is sealed. Can you
Hmm.
throw some light on this, that how what happened, then what happened? So you got the report, you got the report which said you were positive, then?
Yeah. So then, see, generally the protocol is if you are tested positive, the lab itself will intimate government and the BMC that so and so person has been tested positive. So once that intimation went from SRL lab to BMC,
Hmm.
immediately I got a call from my area's BMC doctor
Okay.
that since you have been tested positive, you
Hmm.
will have to get yourself admitted to a hospital. So they gave me those two, three options where,
Was it a
where
forcing, was it a threatening call, or what was the tone of the call?
no, it wasn't a threatening call. They were very calmly, and they were consoling me. I appreciate their support as well.
Wow.
So nothing sort of threatening thing. They gave me that these are the options, these are places which are available where you can get yourselves admitted. Then I spoke with my family doctor. My
Hmm.
family doctor suggested if you uh, have to get yourself admitted, then just try to see if you uh, get admitted at Seven Hills, because Seven Hills has a better facility where Reliance has stepped in, and that's a specific, it's a categorically open for COVID treatment and COVID care you know patients. So then I thought of getting myself admitted at Seven Hills.
Okay.
So my wife started calling up Seven Hills. So Seven Hills, they immediately answered. They said yes, they are having a bed available over there, and you can get the patient at gate number 3 of the hospital, and then admission formality will start. So that is how it happened. And we intimated BMC that we are choosing to get ourselves admitted at 7Ls.
Okay.
So there is nothing that they force you that you have to get yourself admitted at Kasturba or this facility. It is we who have to choose.
Okay. So then.
So then uh, they BMC people also arranged an ambulance for me, because what happens is once you are a COVID positive, the other private ambulance will refrain from getting you transferred to hospital. The only reason is if you are infected, and if that ambulance is supposed to be used for some other patient should not catch up that virus. So on a conservative basis, it is only the BMC ambulances which help you. The dedicated ambulances, they help you for taking you to the hospital. So
I
then
came.
the BMC hospital, BMC ambulance came,
Hmm.
and they uh, took me to the hospital. BMC staff also came, wherein they had disinfected my entire house.
Hmm.
My They have not left any single corner of my house which where they have not sprayed the chemical. Entire what I got to know from my family is that each and every corner, every place, they sprinkled that disinfectant. Literally, my house was watery, watery, watery everywhere, and that is how that got disinfected.
Okay. And
BMC's another vehicle came
was a
which
board put outside
sprinkled.
our house saying that this
Yes, yes,
infection.
yes, yes. So BMC had called up our society's chairman. They had informed that now your entire society would be quarantined because one of the case has been tested positive. Since one of the case has been tested positive, all the people will get that quarantine stamp on the hand that for next 14 days you are supposed to stay in your building itself.
Okay.
And BMC people, they also they were periodically sending the chemical sprinkler where they were fumigating the entire society. So a vehicle used to come at my compound, and there was a pressure, and the sprinkler was spraying all the chemicals.
So,
And that
this happened, and then you were taken to the hospital. What were the
Yeah,
first? So, think of
yeah,
this time. Yeah, what I'm assuming, and I think which is very valid also, that there could be a very mad rush in hospitals. A lot of patients being admitted. Was it a very chaotic situation? So now take us through your journey. You were admitted. So this is on 30th itself. 30th afternoon you got your test.
yeah, 30th. So
So
30th
morning you got
morning when I got my report.
what in two
Yeah,
hours you'll be
and then immediately I was told that that you'll have to get yourself admitted, and I got admitted at Seven Hills.
7 hills.
So I was sitting in the ambulance. I was all alone. I was just worried. I was a bit anxious, concerned about my family. That since I have tested positive, my family should not be tested positive, because the BMC team informed that they will allow my family to stay at my home itself, but they would be isolated. They need to isolate themselves.
Okay.
Tomorrow a set of doctor from KEM hospital will come, and they would do the testing on all of my family members. So that is how I uh, was
So
having
while
those
you were
thoughts that at least my yeah.
okay, so while you were being admitted in Seven Hills, is BMC sent somebody to test to do test on your family members, correct?
Yeah. So next day a team from KEM had come, wherein
Okay.
they collected samples from all my family members.
And again, they had to pay 4,500 for the test.
No. Since that was arranged by BMC, we were
Okay.
not supposed to pay anything for that.
Okay, great. So then now your journey, like you went to the hospital. How are these hospitals equipped? And if you can please share some light on that.
Okay. So I was a bit worried, as I know that it's a isolation, how would be the setup and all. I had all those things in my mind. So moment I came out of ambulance of Seven Hills, I was guided by one person. So he took me along, and I was placed on the seventh floor.
Hmm.
So across wherever I was just walking, putting my steps. So he was constantly disinfecting the place wherever I was walking. Even the elevator when I took, he was disinfecting the same. And once I came on the seventh floor, I was guided by a nurse that you have to get yourself admitted in so and so room. So she guided me my room, and
Hmm.
then she said that since it's an afternoon time, you might be hungry, you wouldn't have had your lunch. So first you have your lunch, and then we'll initiate all other processes.
And what did
So that
she
was
tell you?
how I. But
What?
I told her that I was not feeling hungry. अभी तुमको
Hmm.
हॉस्पिटल में एडमिट होने का रहेगा. फर्स्ट थिंग अगर तुमको आके कोई बोलेगा कि तुमको खाना खाना है, अभी तुम्हारे माइंड में सब अलग अलग तरह के थॉट्स चल रहे हैं, एंड सडनली कोई बोलेगा खाना खा रहे भाई, मैं यहाँ पे किसी को मिलने आया हूँ या ये क्या है यार. आई वाज जस्ट
क्या
हैविंग दोस
क्या
थॉट्स.
और क्या था खाने में, if I can ask?
सो खाने में the first meal which I had is I had chole. What I remember, chole. There were two chapatis, dal, rice. uh, एक sweet भी था, and curd and all.
So
So
I think everybody should be a little relaxed that it is a very normal thing you get
yeah, थोड़ा वो फिर वो छोले देख के फिर वो थोड़ा ऐसा लगा कि चलो भाई अभी खा लेते हैं. uh, we should not miss on that.
हाँ, अच्छे
So
खाने
I
के खाना चाहिए.
हाँ. So initially I washed my hand, and then immediately uh, I
हाथ
had my meal. I
हाथ
was
हाथ
then.
हाथ धोना मत भूलिए, सबसे पहले हाथ धोना जरूरी है.
Yes. Whenever I was in hospital, around 40-50 times a day, literally I was washing my hand. And in that hospital, they had a very nice, hand washing facility where, we
Is there
just
a
had to place.
separate section of COVID patients there? Is there a separate section of different floor? Like most of the hospitals have a dedicated area. And another thing, Harsh, also, like we recently got to know, unfortunately, work hard. All our doctors and other people who are really fighting, they also got infected. So a general thing is also that people can also get infected. So what were they wearing? How did the staff protect themselves? Is there a separate section in Seven Hills that is dedicated to COVID? Can you share some of these details? And
Okay.
were you
So,
were you allowed a phone inside? Were you carrying your phone also with you?
yes,
Acha,
yes, I was allowed to take my phone inside. I had also taken one book with me
acha.
uh, for reading. एंड फोन तो था, बट वहां पे अंदर नेटवर्क नहीं था. अनफॉर्चुनेटली तुम्हारे पास फोन हो और एंड देन यू थिंक कि चलो भाई नेटफ्लिक्स प्राइम में कुछ तुम देख पाओगे. सैडली आई कुडंट वॉच एनीथिंग बिकॉज ऑफ द बैड नेटवर्क इन द हॉस्पिटल. सो व्हाट आई कुड डू इज थोड़ा बहुत फेसबुक पे आई कुड navigate something. WhatsApp पे किसी का देख लिया chat and all, so that all was happening. And
Okay.
then you can have your calls. I was getting calls from my relatives. Some were genuinely bothered that what happened, why such thing happened to you. And some of the relatives, in every family you will have, not all relatives are your well wishers. सब लोग के फैमिली में कोई ना कोई ऐसा कैरेक्टर तो रहेगा ही. बट मेरे मेरे फैमिली में भी एक दो ऐसे थे जो जिनको लगा कि अरे चलो इसको कोविड हो गया है, चलो अच्छा है, लेट्स इसको क्या होगा, क्या इंटेंसिटी है इसका, तभी आप बाहर आ भी पाएगा नहीं आ पाएगा, कि क्या होगा. सो they were just calling for having some fun कि चलो भाई अच्छा हुआ इसको कोविड हुआ तो.
Acha.
So
But
that was the thing.
but overall, is there a separate section? How are the staff protecting them?
Yes. So there is so that Seven Hills facility is currently catering to only COVID patient. So there was a dedicated floor where only COVID patients are being kept,
Okay.
and they had those all the nurses, doctors. They were wearing their protective gears, the PPE. They were wearing it.
Okay.
So, and also they were properly disinfecting the room. A person was coming periodically, he was disinfecting the room. And also the garbage bags, those were dedicated garbage bags, whatever we are disposing, and that was properly being taken care.
So this, in fact, is of very importance for us. Like I mentioned, that we are a recycling company. So what you're saying is that even the infected waste is being properly thrown in a separate bag and being disposed of in the right manner. Correct?
Yeah.
Okay. And so you were admitted 30th, and how many days were you there? You have a room to yourself. Testing is happening every day. And how many days were you there in the hospital?
So I was there for 5 days.
Okay.
So initially, when I got admitted,
Hmm.
doctor told me that at least 14 days hoga. So first thing what they tell you is that 14 days.
Okay.
Gradually they tell you that okay, if your immune system is good, you don't have any other complications. So at times what happens is some people who have kidney problem, dialysis, some a cardiac patient, someone with very high diabetes, elevated BP, they might have they might take some time for recovering. But otherwise, if I would like to tell everyone that if you don't have any complications, your immune system is good, you will recover in a week's time or max to max 8 or 10 days. That is what you will recover. So that is what the doctors told me. On
Okay.
day one, they took my chest X-ray.
Okay.
Thereafter, they did my ECG.
Okay.
Then they were periodically monitoring my BP, pulse,
Okay.
diabetes, and also they were monitoring the other parameters like fever and all. So thermometer and all constantly that was on.
And were
I
you
was
alone in one room, isolated?
no. I was not isolated. So my room was a twin sharing room. So there was a proper gap between the two beds. There was a one partition as well. My room also had a television set, and on the same day when I got admitted, there was one uncle, who 54-year-old uncle who got admitted.
Okay.
So in his case, his family, he has his wife, uh, he has a son, a 23-year-old son, and a mom around 70 years. So
Okay.
luckily, in his case, he he was tested positive. Only he was tested positive, and his wife tested positive. Son was tested negative, and mom was tested negative.
Okay.
And then
You had company.
yeah, so I had his company. I had his support where we were just chatting with each other. We were reminding each other that we need to have warm water now. Corona ko harana hai, and all that.
Okay. So I
So
think
we were also given a very good thermos, Milton thermos, where constantly the hospital authorities were giving
we
us
should have
warm
actually
water.
asked Milton. We should have actually asked Milton to endorse this. Since you said Milton Thermos, we should have gotten some
Yeah, yeah.
brands to participate this one. Okay. So great. So so was a test being done on you every day, COVID, to check whether you are recovering?
So not every day. My COVID test, the first test, I got admitted on 30th. First test was done on 31st of March, and then the second test was done on 2nd of April. And I got discharged on 3rd of April because my two tests, consecutive tests, were negative.
So if two tests are consecutively negative, then they discharge you.
Yeah, then they discharge you. So in the hospital, I was given all oral medicines. So
Okay.
my main drug comprised of Tamiflu,
Okay.
hydroxychloroquine, which Donald Trump keeps on insisting on that drug.
And
So
we have
I was taking Tamiflu and hydroxychloroquine. I was given vitamin C tablets. I was also given zinc tablets, and there were other couple of drugs which I was given. So it was all completely oral medicine. Nothing that that I was given IV or I required any oxygen treatment. Nothing that sort of. Because most of the cases in my 7L setup, everyone were absolutely normal, behaving like a normal person. In fact, there were 10-year and 13-year-old children also in
okay.
that facility who were corona positive, and they were getting themselves treated. So they were also playing in their room, they were watching TV. That is what the nurses used to tell me. And I really appreciate all the doctors and the nurses, healthcare support staff, because what I got to know from the nurses is that one of the nurse was staying in Kandivli area, in my area,
Okay.
but she wasn't going back at the day end to her house. She was staying there only, and they were just taking care of all the patients. So you can imagine the kind of sacrifice which they are taking for someone else's happiness.
I think it is so wonderful. So Harsh, again, what we have read is, so I think God's grace that you recovered fast, and in a matter of 5 days, we'll come to your discharge part also. That
Yeah,
also my question then would be that how much did you land up spending? Because I think it'll be very interesting to know that if at all you get admitted, because I think the financial pressure and fear is also there. But
yeah.
what I understand is you took care of yourself. Luckily, you did not have a lot of other complications. And why are we seeing so many deaths? Like, in fact, I just have my news on my phone as well, and I think there are we are crossing more and more. So, uh, at least from your story, it's a very positive story. So, is it because the people who get admitted, if at all they have other complications, and India being a large population, the number is also very high? Is that the case? What would you have to say on that?
See, if you see the global data also, almost 80% of the cases do recover. Hardly 20% with some complications. They need some additional support, with respect to oxygen and ventilator, and a very worst case, they need ventilator support. So as I told you that, if you have some complications in your body, like, if your kidneys are not functioning, you're on dialysis, if you're a cardiac patient and very high elevated diabetes level and all some other complications, so then you have a challenge in recovering. But if you don't have any such complications, you tend to recover very quickly. I was also reading one article of a student who was admitted at Kasturba. Even he got discharged within 6 and 7 days flat. So I just want to tell everyone that you need not worry. You tend to recover. You tend to come out of this, because not just my case, even my neighbor, the uncle, 54-year-old uncle who was admitted, even he got discharged in flat 7 days. His wife, who was tested positive, even his wife got discharged in flat 8 days. So, so that's the case, where you should not panic. Uh, that's a most important thing. And what advice we were given is that this particular virus
Hmm.
stays in your throat whenever you do your testing.
Hmm.
So they collect your throat swab. They collect your swab out of your nostrils. So we
Okay.
were advised that if you take steam, if you inhale steam, and if you have a lot of hot water at periodic intervals, so whatever that sticky mucus is there in your throat, so that would settle down, and gradually your virus will ease out.
Okay. So hot water and steam is something
Yeah.
is highly advisable. Would you recommend to all the people who are locked down right now, sitting at home also, to do it irrespective regularly?
So yeah, you can have warm water. Maybe you need not take steam. If you throw up some symptoms, I would advise people that you need not be your doctor by your own self.
Hmm.
I got a call from my one of my colleague saying that my father is having a fever. उसको fever है तो क्या उसको COVID है क्या? Then I asked her कि boss कब से उसको fever है? Just उसको कल से fever आना चालू हुआ है. अरे how will I get to know that कल से अगर fever आया है तो that means that's COVID only. So that is how now the situation has become कि किसी को अगर fever भी आता है, people think that नहीं ये तो COVID ही होगा. अरे it is not necessary that it's COVID. You
Go to your doctor.
reach out to your family doctor,
Yes.
yes, and then accordingly you get the treatment done.
Okay. So Harsh, so 5 days you were there. Like you said, if two times, if your test is negative, you are discharged. So what was like? How did the discharge happen? And like I asked you that, how much did you have to pay? Like, was it the last day the doctor said, "Go, you're a free bird now. Go fly," or if you can just take us, then what happened?
So then I was not expecting that I would be discharged within 5 days, flat 5 days. So I
Yeah.
was thinking at least 8 10 दिन तो निकल जाएगा.
And
Suddenly,
then,
doctor, during so there was one doctor daily used to see me.
okay.
In the morning they have those daily rounds. So wherein the doctor told me that, okay, so we have got your test reports negative, so you would be given discharge today. So I was shocked. Arey, I've recovered. Uh, so
Are
that
you
was,
enjoying the uncle's company too much, it seems?
yeah. So basically, the first day when I got admitted, I
Hmm.
was so anxious. I was, literally crying. I was showing, see, this is the photo of my son, photo of my wife. This is how, we were happy going out, chilling, and,
Hmm.
doing all sorts of fun and all. And now see where I've landed. So my only concern, something which was bothering me on my head was that, my family should not be tested positive. So on first day I had only that concern. Then on the second day when the KM doctors came and they did the test, so I was bit relieved कि चलो उनका एटलीस्ट टेस्ट तो हुआ है. Let's see, we'll wait for the outcome कि क्या आता है. Because I got to know from my neighbor that in his case only wife was tested positive, son was not tested positive, mother was not tested positive. So it
So
all depends. So then I was also praying.
okay, how much did you pay for the entire 5 days and
So
4 days?
I had to, I didn't have to pay anything. So entire cost was borne by Reliance Foundation over there. And what I understand is all the other setups as well, like Kasturba and all the BMC facilities, they don't charge you anything. It is borne by BMC and the state authorities.
So is it at the time of admission they ask you that do you want some financial assistance, or this is a given that when you are admitted during this phase there is
So
no.
on first day when I got myself admitted, I am having a Mediclaim policy. I spoke with my insurance advisor. He told me that your this medication will get covered under your insurance policy. You need not worry. So I had a very good adequate chunk of mediclaim. So I was not bothered के for my treatment कि अगर नहीं भी होता है तो I would be claiming it through insurance. So I just told the authorities over there on the day one that I'm having so and so policy, but
Hmm.
then they told me that no, this is entirely free of cost. You will not be charged anything. This is borne by Reliance Foundation. So that is how this
So
happened.
I in fact so when you got discharged, I had seen this one video on your social media page, which went viral, I think, on YouTube, where you're building people, everybody in your society. Generally, I think एक एक बार तो ऐसा लगता है कि यार कहाँ इसके वजह से हम भी फंस गए. I think today's time, society people, everybody would also feel that just because of one person, we also have to be quarantined. We have to take extra precaution. But I saw this one video where, so you were discharged again. I think a BMC ambulance took you back. Is that the thing? And then when you reached, how was it?
So
Because
then it was a private ambulance. I took a private ambulance. Because generally, what BMC ambulance do is, if there are any COVID patients, they cater to the COVID patients. Then I had taken a normal ambulance, and that is how I came back home.
and the video I was talking about is where Harsh is seen coming back, and the entire society is celebrating. They are dancing and they are
Yes, yes,
cheering.
yes.
Can you say a little bit about that?
So basically, I had a very good support of my society people.
Mm-hmm.
It wasn't that that I have been tested positive.
Mm-hmm.
They were having a fear that this particular family is tested positive. Then because of them the entire society is quarantined and all. So
Mm-hmm.
I was getting all the support in my common society WhatsApp group, where they were constantly asking about my health. Because see, at times kya hota hai, you do have your relatives, but your best immediate near and close relatives are your neighbors, because your neighbors would be the first person. If anything happens to you, they would be reaching out to you first. So then since I was admitted in hospital, they were very helpful to my family, to my wife, to my mom, that that if you need any grocery, if you need anything, then we all are there with you. So I got a very good support. And also the day when I got a discharge, my ambulance came. I had just pinged on my WhatsApp society WhatsApp group that I'm just coming on my way home. the entire society was down, and they gave me a very good, warm welcome. They all clapped and cheered for me, and that was a very
Hero is
nice feeling which I had.
Hero is back home. So Harsh, last question, and then I think Samarth will take over to see that if at all we have questions from people who are there. Uh, if you can just sum it up, like I think what really inspired me when I saw your post is the positivity, and I really think this is a battle of mind over matter. It is definitely a little more
Yeah.
serious virus, but it can be cured if you take care of yourself. People need not worry. I
Yes.
think the local system, authority, support system, I think is fantastic. So
Yeah.
anything, what kept you going? Like what was your state of mind? How did you keep positive? If you can, your last remarks on that.
Okay. So, one advice which I would like to give all the people is that uh, COVID is not an end. Even if, and touch wood, you shouldn't get positive, but if you happen to contract this virus is curable. It isn't that it's an end of the world. What you need to have is, what I was told by my doctors is that you need to have a very positive mindset, because if you have a positive approach, then your immune system would be better. Otherwise, if you have that stress that अरे मेरे को है क्या होगा, if you keep on thinking, then the ramifications of it are very bad on your immune system. You would be damaging your immune system. So you should not worry. Most of the cases which in the data, if you see around the world, people tend to recover. So if your immune system is good, you are eating healthy, you are having warm water and all, taking proper medications which the doctors are prescribing, and
Hmm.
then definitely you will come out of this.
Thank you so much, Harsh. I think it's so fantastic, and I think so many myths got cleared. The kind of like I think a bigger thing that you said is the hospitals are not charging, and I think in these times humanity always
Yes.
is prevails. So I think great. Now I think over to you, Sam. Maybe if we have questions from people, we can take it.
Thanks, Karan. Thanks, Harsh. There are a ton of questions that have come by, so I'm going to try to take most of them. All the ones that I've covered already is something that I will try to avoid, right? So, one of the questions that let me start from phase one, which is uh, when you were going to your office, were you wearing a mask then?
Yeah, I was wearing a mask.
Okay, so even then you landed up getting this sort of a problem.
Yeah.
Uh,
So generally, see what happens is, if you touch, because this virus, uh, based on what I know, is it does not stay on the air. It settles on some object. So if you happen to touch that object where the virus is there, and then if you tend to put your hand around your mouth, nose, or face, so then you tend to get contracted.
okay. One of the other questions is what preventive kit one should keep ready at home to keep with and carry while admitting to the hospital in response to COVID?
Okay. So, as normally if you are getting yourself admitted to a hospital, you can carry some 2-3 pair of clothes, because at the hospital they do give you clothes and all. In my case, the top was not fitting me well, so I was wearing my own t-shirt, and the bottom fitted me, so I was using the bottom as given by the hospital. And then I was washing my own clothes in the bathroom. So I had taken a shower gel, shampoo, paste, shaving kit with along with me. So that is what basic things you can carry along with you. So what they tell you is that whatever clothes you were wearing on day one, those clothes you are supposed to dispose. You are not supposed to uh, take back those clothes home, and rest of the clothes you can take back home. So once I came back home, I immediately went to my bathroom. Already the hot water, everything was there. I removed my clothes, and all those clothes were put in Dettol and normal this. Surf Excel hot water, and then that is how.
Interesting. Uh, were you questioned by any of the parties on all the other prospective people that you may have met, or places that you went to, or the cab that you took, the doctor that you met, etc.?
So BMC took a complete note of which all people I would have met. Okay, so I had informed all those people. They also were calling them up. They also did test on those people, BMC, what I got to know. And so that is how if I would have come into contact of any other individual, so that is how they get themselves tested.
So what are all the other precautions in terms of you wear a mask on your mouth? Uh, should we also have that clear full face shield, or would there be anything else that you would recommend for people who step out for, let's say, groceries or something like that?
So only thing is, you need to be very careful with your hands. So what I've heard and read, in US, that doctor who specializes in infectious disease, Dr. Fauci, he washes his hands. He said he washes his hands 100 times a day. So you keep a good sanitizer with you. Wash your hand if you tend to touch up your face or mouth, or if before you have your food, it's better that you wash your hands. So even if you are staying at home, you are quarantined, isolated, it's advised that you do wash your hands. Even if you are at home under lockdown, please wash your hands with soap and then only eat your food.
Right. So Tamiflu and hydroxychloroquine, I think
Hydroxychloroquine, yeah.
that's quite a tongue
Yeah, yeah.
twister. Would you recommend people who have symptoms to already start having this, or would you say that they
No,
should
no, no,
first?
no, no. They should not start having it. They should ask their doctor, and if doctor prescribes, then only they should have those medicines. Else they should take voluntarily those medicines.
Right. So, as I record, the 10th day from the onset of the symptoms, there is a relapse of symptoms and it's quite bad on day 9 or 10. Did something similar occur at your end? And did you notice the symptoms of loss of smell or loss of taste?
So I didn't I would not know that I would have lost that smell or something like that. But the thing that bothered me more as a part of my symptoms was, so my doctor was already giving me paracetamol. So since I was already taking paracetamol, I was not having fever. So my fever was under control because my medication paracetamol was on. Even in spite of taking paracetamol, I had a very bad backache. I had a very bad body pain, stomach pain. Still, I had some chills, and I had a very bad fatigue, weakness. So those were my symptoms.
Fantastic. So, one of the last questions.
Yeah.
How did your organization really react to this? And also another intermingled question is that your case seems to be like a mild case. Are there different variations of severity of this disease?
So it all depends on how good your immune system is.
Mm-hmm.
So as I said, my neighbor who is a 54-year-old gentleman, even he recovered within flat 7 days time. His wife who got tested positive, even his wife recovered in flat 8 days. So people do tend to recover. You should not panic as far as your recovery is concerned.
Fantastic, guys. So I think that brings us to the end of the Q&A session. Karan, if you have anything else to add.
Yeah, so I think great. Yeah, thank you, Harsh, again for such a fantastic crisp session on your journey and answering all those questions. I would request you that a lot of people. In fact, I think Sam, what we can do is we can actually take a round of quick thing. I think there are a lot of messages coming. Maybe now you can.
Yes, still, if I'm open for some more questions, if
Yeah, so I think there are.
So if y'all have any more questions, I'm happy to take them. If you could just keep posting on.
Yeah, or else, Harsh, what we can do is, maybe on our Facebook page, we can just ask everyone to just come there. And since we had this session with you, you can answer. Will that be okay? Where I think a lot of people who participated today, anybody else, they can
yeah,
just comment
fine.
question, and on that you can answer it. I think that'll be very helpful for everyone.
Okay, okay.
Yes, and there is one more question. I'm assuming that you informed your organization. Okay, I think this is already taken, correct?
Yeah, I informed my organization. I got a very good support from my organization also.
Yeah.
So our managing partner, he texted me about my health and all. Even my assurance head, all of the partners, they were inquiring for my health. So I also got a very good support. Even my HR was inquiring. Even my HR took precaution. Whosoever uh, people in my office I would have met, they were also told to get themselves tested, to be in quarantine, and also all those precautions they had taken, and they were also praying for my well-being and all.
Superb.
One of the question which I can see is that someone is asking that is there a separate room for each patient. So then, okay, mine was a twin sharing room where two people were accommodated in a room, and my room also had a TV, so that was a good thing. I don't know about the other setups, but what I understand is now a couple of private hospitals have also started, like Fortis, Wokat, Nanavati, Just Lok, all those hospitals have uh, they have also started, but they are
Harsh,
having
yeah.
some limited beds.
Harsh, like I said, the best is to take more questions on the page if that's okay. Because
Yeah, sure.
And I think
Sure.
to sum it up, I really feel I could see some people saying that it was maybe a mild infection. I think to my mind, if I were to see the story, I think the chole that you had in the hospital was some magic in it, which is where you recovered faster, and which is what I think the hospital gave you first. But nevertheless,
Yeah.
we are very happy and pray for your and your family's good health and wishes, and for everyone. And thank you everyone for joining us today. And
Thank you.
fantastic story gives a lot of us a very good positive mindset that this too shall pass. And I think if we do take the right steps, we shall.
Yeah. So in
Thanks,
the in
guys.
the words
Follow
of
us. Sorry, go ahead.
Robert Schuller, I would like to end it that tough times never last, tough people do.
Whoa! Fabulous.
Great.
Okay, guys. So follow us on Facebook. If you have any more questions, please let us know, and we will be happy to get the questions clarified. Thanks a ton, guys. Bye.
So, thank you.
Bye. Goodbye, everyone.
Bye.